Hello, everyone. My name is Anna. I'm a second-year medical student here at Stanford, and today I'll be presenting our research on evaluating the impact of the COVID-19 pandemic on emergency Medicaid programs. So we focused on trauma patients, which are patients who are twice as likely to be uninsured as the general population. And this leads to limited access to post-injury resources, as well as a higher mortality rate. The Medicaid program that we focused on is the hospital presumptive eligibility, which we refer to as HPE. And this program was enacted in 2014, offering patients a route to health insurance for those who are eligible low-income patients by enrolling them in Medicaid at the point of presentation of their trauma. The HPE program underwent several policy changes due to the COVID-19 pandemic, with financial counselors and other staff having to adapt to remote working and other eligibility criteria changes. We sought to quantify the success of this HPE program during this time of the pandemic and derive features associated with potentially eligible patients who unfortunately failed to be approved for HPE. So we conducted an explanatory sequential mixed method study, including a retrospective cohort analysis of trauma registry data from a level 1 trauma center here at Stanford, comparing HPE approvals from 2015 to 2019, which is our pre-COVID era, and 2020 through 2021, which is our post-COVID era. Thematic analysis was also conducted of semi-structured interviews with key stakeholders. These include social workers, financial counselors, and contractors who are directly involved with the HPE application and approval process. So our trauma registry had a total of 736 patients who were listed as self-pay, presenting with a trauma during 2020 through 2021. Ultimately, we included 691 patients, of which 221 were uninsured on arrival. 470 already had Medicaid on arrival. Of our uninsured population, we had 199 patients that were screened by financial counselors, and ultimately 120 were approved for HPE. This is a 60% approval for the HPE program. So this 60% approval marks a significant improvement in HPE approval rate before the pandemic, which was at a 41% approval rate. And in our adjusted logistic regression model, the cohort post-introduction of these new COVID policies was associated with an increased likelihood of HPE approval. So these stakeholder interviews that we also included indicated two possible explanations for this increase in approval, one being an improvement in remote approval via telephone and video conferencing with patients and families, and also state-based expansion in HPE approval eligibility. Ultimately, HPE programs have increased their overall approval rate and have adapted to policy changes at hospitals during the pandemic, enabling a higher number of people to get access to health insurance. So ensuring that these beneficial changes remain a part of our health policy is absolutely key to improving access to health insurance for our patients. We hope that these findings can inform future directions and modifications in policies for HPE programs, as well as other Medicaid programs. And expanded criteria implemented during the pandemic, if continued in the future, have the potential to expand access to health insurance for underinsured patients across California, not only just at Stanford. So our next steps will be to identify variations in HPE approval and Medicaid sustainment across hospitals and identify the patient and health system facilitators and barriers that still exist. The long-term goal is to ensure successful uptake of long-term health insurance through HPE and also through other programs. Thank you so much for your interest in our research on evaluating the impact of the pandemic on emergency Medicaid programs. If you have any questions, please feel free to email me at any time.